I'm Adrian James, I'm the President of the Royal College, and I'm really delighted to be here.
My name's Abby, and I'm the Careers, Information and Quality Lead for the NHS Health Careers team. I hope to be able to get across to you some of the amazing opportunities within the NHS.
We have got podiatrists, occupational therapists, speech and language therapists.
So we're going to talk about good medical practice, we're going to talk about protecting patient safety.
Because of the restrictions, because of remote working, because of the lack of face-to-face contact, because we have to manage patients a different way, we've had to think differently about how we manage this work and how we use technology.
I'm in London, so good to see you. I think we've got Ian here as well, haven't we? Hi, Ian.
Hey guys.
We are not the only people who are facing problems, but actually through sharing those problems, we can become the health professionals that are required for the globe and for the NHS in the future.
It's been really interesting hearing all your top tips. I've got my list now. I can pack my bags. I'm going to wear my seatbelt for safety, but I am going to look out the window ahead of me and enjoy the trip.
It's just about us finding the greatness within us and bringing it out and being our best self.
Hello everyone, my name is Faisal Nawaz and welcome to Health Careers Live Middle East. Today is an exciting day for all of us as we have a promising lineup of speakers and panelists to discuss some of the key topics and events that revolve around Health Careers Live. Just like our previous successful events, we will be bringing on the speakers to come. Before we move forward, I would like to let you know we have our chat box to have any comments or questions during the session from our viewers, as well as our social media handles at Health Careers Live, as well as hashtag Health Careers Live to keep your discussions going, and any questions you have, our team is more than happy to welcome them. As the exchange lead of Health Careers Live and an international medical graduate based in Dubai, I welcome you all to Health Careers Live South Asia, and I hope you enjoy today's sessions. Before we come forward, we'd like to also thank our key partners from NHS HEE, GMC, and the Health and Care Professions Council. And in terms of the speakers joining us today, we have Rachel and Kim representing GMC and the HCPC, as well as Dr. Sridevi, who would be coming in after their talks conclude. So before any further ado, I'd like to welcome our speakers and how they shed light on the importance of international medical graduate training and what the GMC and the HCPC contribute in terms of the care for the NHS workforce.
Hello there. Are my slides up yet showing Faisal, do we know?
Yes,
there we go.
Slides loading in. Yeah, your stage is yours,
Perfect. Thank you so much. So hello, everybody. Thank you for joining us this afternoon. My name is Rachel Woodall, and I'm something called a Regional Liaison Advisor for the General Medical Council, which I'll explain a little bit more about as we go through today's session. But delighted to be part of this event and also showcasing some of the work that we've been doing for a number of years now in relation to supporting international doctors who are new to the UK. We know there are lots of challenges, many opportunities, and it is such an important contribution that those who qualify outside of the UK bring to the UK Health Service. So delighted to be involved in this event and that you could make time to join us today. So I'm going to take the first part of the session, and then Kim Tolley from HCPC is going to join afterwards and explain a little bit about what HCPC are doing in relation to their registrants. But at first, I'm going to explain what the General Medical Council, the UK regulator for doctors have been doing in relation to the support that we're providing. And the aim for today's session, really, over the next 25 minutes or so, is for you to understand a bit more about what GMC resources are available to ensure a good start and maybe explore a bit more before you even arrive in terms of becoming a doctor in the UK. There's lots of support out there, there's lots of information, but we also know there's a lot to navigate in addition to moving your life to a different country and everything that comes with that. Obviously, moving your professional practice as well into a different country can have many different ripples in terms of things that might need to change or adapt. So hopefully you're going to become familiar with things to go and look at on the GMC website. Hopefully you'll have a little list by the end of things you want to go and explore. And in particular, I'm going to give you an overview of our free half-day session that is offered to all doctors joining the UK register, called Welcome to UK Practice. So we'll do a little taster session of that so you can have a look at what you might be signing up for if you were to join the register and attend one of those. In relation to my role, by background, I'm a solicitor. I used to be involved in clinical negligence matters, defending those, and also have worked in-house in the GMC in the fitness to practice team there. But really excited to be part of the regional liaison service when they were first formed back in 2012, which is more about coming out and engaging proactively with those who we regulate, unpicking some of those challenging areas and maybe some misconceptions around things as well. So we are a team that is based both regionally and nationally in the 4 countries of the UK. And our role is to help improve understanding and awareness of what the GMC do, how we do it. But importantly as well, a lot of our time is spent exploring some of the more challenging professional and ethical aspects of being a doctor. And challenging areas in particular, things like consent, confidentiality, even things like navigating use of social media. And we do this predominantly through teaching and engagement workshops, which pre-COVID tended to all be in person, although since COVID, obviously a lot of things moved online, pretty much everything, and now we're doing a mix of things, which is brilliant because we've adapted to delivering things like we are today in this format. And also an important part of our role is not just for us to be here in broadcast mode, even though we are largely in that today. In general, our role as well is also to help gather and share insight. And I suppose when people ask, how are the GMC connected to those on the ground, to doctors working in hospitals and GP practices, one of the ways is through us as a service, because we come in locally and deliver things, whether that be into teaching or training that's already happening in an NHS trust or other ways that teaching might be delivered. So it's about bringing kind of the GMC to you and helping you explore some of these difficult ethical areas. So in terms of how we do that, a lot of our work is delivering workshops, and some of that might be things that are kind of a standard 1 hour on a core topic. And you can find all information on our website if you ever wanted to understand a bit more about what we offer. We do offer some other more tailored things as well. So we have a full day session called A Day in the Life of a GP. But one of the things that we've also developed, which has been hugely successful and taken up, importantly, a large amount of our time in the team as well in recent years, is our Welcome to UK Practice programme, a session specifically aimed at those who are in their first year of joining the medical register in the UK, although it is open to others who want to attend as well, who may have missed that window initially. So we'll explore a little bit more about Welcome to UK Practice, but I think one of the most fundamental things that we do in Welcome to UK Practice is explain a little bit more about the GMC. So very, very briefly, I'm just going to do that for you today. I'm not going to go into great detail on this given the time that we've got, but in a Welcome to UK Practice, if you were to sign up, we would go through all of this on the left-hand side. So we commonly refer to this as our kind of jigsaw slide explaining our core functions at the GMC. And these are the things that are set out in law in something called the Medical Act as to what our roles are. You can also find a whole host of information on our website about all of these different areas, because when we talk about Welcome to UK Practice and supporting doctors new to the UK, I'm really aware that Welcome to UK Practice largely focuses on our standards. So that bit that sits in the centre here. And it's not by accident that it sits in the centre, because our standards, the guidance that's in place to the profession, to doctors, is so important in underpinning all of these other areas. So today, for example, I'm not going to cover a great deal in relation to registration, but I'm conscious that some of you might have queries and might be starting to explore that. So I would highlight that if you go onto our website, follow the blue bar at the top, and if you just click on registration, you may have already found there's lots of useful pages there, there's videos, and there's lots of frequently asked questions sections for the common things that we'll hear when people are considering coming to the UK. There's a page specifically dedicated to doctors coming from outside of the UK who may want to consider coming to work here. So just to highlight, you can find more information there. But importantly, when we talk about our standards as well, it is important to highlight that they do have a role as well in relation to fitness to practice. And we know that there can be a lot of fear sometimes and misconception around fitness to practice. But in terms of the standards that are issued to the profession, medical professionals are expected to act in line with that guidance. And if they seriously or persistently don't follow that guidance, and there's no particular justification for that, and particularly if, for example, that puts patient safety at risk, that might be something that we need to look at in our fitness to practice processes. The vast majority of things can be dealt with locally and do not ever need to come up to the GMC. But it is important just to understand that when we talk about GMC guidance and standards, it is actually something that if you register as a doctor in the UK, you are expected to act to that standard and to follow that guidance. So why do we need a Welcome to UK Practice course? It was actually all the way back in 2012 that we called for some form of standardised induction programme for doctors who were new to the UK. Every year we publish an annual report called The State of Medical Education and Practice in the UK. They are all available on our website for every year if you wanted to explore them further. But in relation to State of Medical Education and Practice, one of the things that had highlighted, for example, is that doctors who qualified outside of the United Kingdom actually faced some particular challenges and were more likely to be complained about by employers. So they were more likely that employers would refer them to the GMC. And that is something where a lot of further research has been carried out in relation to what more can be done to support here. And importantly, what are the dynamics that are playing into this before something even gets to the GMC, but is happening at a local level. And it probably won't surprise you to hear that some of the factors that came out involved how integrated people feel when they join the UK for the first time, or join an NHS trust, or maybe move round a different employer each time they move round. Is there a risk that perhaps they're seen as an outsider? Is there a risk that there might be challenging work environments that they're in? Is there a risk that there might be challenges in relation to the colleagues that they're working with, and those understanding the challenges that this individual might have, but also the benefits and strengths that they bring as well. So it's been felt for some time that there needed to be something in place to support doctors new to the UK. There's so much to get to grips with in terms of things that might be different in the UK in relation to your medical practice. So we first piloted this as a full day course, and it ended up being reduced down to a half day course to make it easier for more doctors to attend. And the Welcome to UK Practice course can't cover all of those things that we know that are a challenge when moving yourself to a different country to practice. There are so many challenges, not just related to your clinical practice, but moving your whole life to another country, visas, navigating financial systems, opening bank accounts, so many things. But actually, there really importantly are some aspects that we can help with. And some of those aspects are around the things that I just talked about on the previous slide. So in particular, the guidance that's there to support you and navigate you through some of these ethical areas, for example. So that's why we put together the Welcome to UK Practice course, and we've been running it for around the last 10 years or so, and fantastic now that it is also built in as part of the standardised induction programme across NHS England, that area. So it's something that's been rolled out across all 4 countries of the UK and is available, and sometimes different employers were already doing a more enhanced induction, but Welcome to UK UK Practice is something that might be offered to you locally if you were to join, but it's also available to any other doctor who joins. So any doctor who joins the register, starts that process of registration, you will open something called a GMC online account. And via that GMC online account, you can actually go in and book yourself onto a Welcome to UK Practice session. At the moment, most of them are still running online, but there are around 2 to 3 that are available every week to log on to sign on to. So the access is really easily there. And as I said before, sometimes if you're joining a particular trust or in a particular locality, it might be that actually they've asked one of us to come in person, and we might be delivering this to you in person. So worth asking when you're looking into that as to whether it's something you should log on and do yourself, or whether it's something that might be provided as part of your wider induction. So in terms of Welcome to UK Practice, as ever, our website has a lot of information that will help you navigate and understand a bit more about this. And lots of the tools are available to anyone. So you don't have to log in or have an account yet. It's all publicly available on the website, including, for example, on the right-hand side there, a top tips blog from Dr. Murad, who attended one of our Welcome to UK Practices. You can also see there you can actually book your place via GMC Online, some guidance around how you go on to do that. And we also cross-reference to videos that explain a bit more about the course and some of the things that you would explore across that half day, acknowledging that giving up half day of your time is potentially quite notable when you've just started somewhere, but employers should support you to do this. The support is not just the half-day workshop either, which is delivered by regional liaison advisors like myself and some of our associates who, certainly through the number of these sessions we've now delivered, are experts in the GMC guidance and just the shock of coming to practice in the UK. But in addition, there's also a free online self-assessment tool, and anyone can access this. So it sits on that Welcome to UK Practice page, and you can complete that yourself. It gives you different ethical scenarios. It asks you, what do you think the doctor should do in this situation? You get given the choices. You say which one you think is most appropriate. Then it will give you the right answer. And what it will really helpfully also do is at the end, it will give you an indicator as to where are your strengths guidance-wise, but also perhaps where are some of the challenges, where are some of the areas where you might really need to go and spend a little bit more time exploring that guidance. Okay, so that might be quite useful for refining kind of any further work that you want to do in getting used to the GMC guidance and what's expected. So, does it actually help? Does attending this half day, apart from you doing it, does it actually help? Does it assist people? Well, the feedback we get is phenomenal from this course. It's one of my favorite things to deliver because the feedback that we get live in the session is phenomenal. And also the questions that we get are brilliant. It's such a fantastic opportunity for you to speak to someone from the GMC in maybe what seems like a friendlier way in terms of you feeling at ease to ask your questions or things you've always wondered about. And you can see from those statistics there, which is just from a couple of years ago when we did a last kind of full round before COVID of feedback, you can see in terms of figures like, would you change your practice as a result of attending? 91% of people said that they would actually change something in their practice as a result. It's also not just the feedback forms that we collect. We have actually had an independent study from Newcastle University carried out, which took place over quite a significant period of time, which involved interviews with participants, questionnaires, follow-up work 3 and 6 months after as well. And this noted significant improvements to the understanding of GMC guidance, and also even at a 3-month follow-up period, those who had intended to change their practice, it had actually led to changes as well. So we know that it is helping. It doesn't necessarily cover all of those challenges, as I mentioned before, that we know are enormous when you move to a new country to practice, but does show that this is something that can assist, and obviously is something that's there as a free resource, is definitely something you should access if you are coming new to the UK to practice as a doctor. So I'm just going to now take you through a little taster of Welcome to UK Practice. It's a full half day, so we cover really quite a lot in it. And we always start the session with a little bit of getting to know you, getting to know who's in the room, whether that's a physical room or a virtual room. And that can take a different amount of time, really, depending on the size of the group and the dynamics. People might already know people really well if, for example, this is one that's been held locally. And what we'll spend some time in the session doing as well is exploring and reflecting on people's experience in coming to the UK. And we play a video that's around 10 minutes or so long with a number of different doctors who qualified outside of the UK, sharing their experiences. So things that they wish they'd known, sharing things that some things are quite, almost fun in terms of them getting to know accents and dialects. It's one thing to be able to speak English, but across the UK, we have some very different dialects. We have some very different accents as well. So that can sometimes be kind of a lighter talking point along with the weather, but also sharing things like just how exhausting it is to concentrate in something that's a second or third language all day. The challenge of getting used to so many new abbreviations, particularly in the NHS as well, getting used to the structure and the job roles and who does what job roles and how the team dynamics work. Sometimes that can be very, very different from the type of hierarchy or other system that you might have had in other countries. So the Things I Wish I'd Known video is a really useful video that we then try to use as a platform for sharing some tips. So we'll always open it up and say, what really resonates with you from this? And then we try to get people to share some tips as to what they've done to assist around that, or maybe things that have been recommended to them as well. We also share a few tips as well that we've come across through our years of delivering this as well. And what we also then move on to is thinking about ethical scenarios and putting GMC guidance into practice so that you can see how useful this is. It's not just a list of do's and don'ts, it is about what does good practice look like. So one of the activities that we do is called Always, Sometimes, Never. And this can differ, isn't it? If we're all physically in one room, pre-COVID, it used to involve people moving around the room, and we'd say that corner is always, this one is sometimes, that one is never, and people would move around the room. And it was a good way of getting some activity as well, potentially in across a half-day session. But now we tend to do it using online voting and chat function. So what we do is we give a scenario, like, for example, one that I've put on the screen here. And this is one that we discuss in the sessions. And we deliberately start off with something that actually is quite a small thing, potentially. Someone offering a gift of chocolates. So a patient that you've been treating, would you accept them always, sometimes, or never? And I'll just give you a moment to think what you might say. And we always say that if you're saying sometimes, we will ask you in the chat, or if we're in the room in person, to just say, what does that depend on? Because actually what you'll find in many of these ethical situations and in a number of areas of GMC guidance is sometimes it's very clear, sometimes there's a yes, no answer. For many of them, there may be it depends on certain factors as well. So I'm just giving you an example from a recent vote that I did in a session on this question. So sometimes we can have quite a mixed response on things, and we'll then unpick, so what is the right answer? Obviously taking you to the relevant extract from the GMC guidance, because that's quite important in terms of taking you through this and you becoming more familiar with the GMC guidance. And we unpick the paragraph. So for example, this one starts off with a you must not, and must is the highest level that we would state things in GMC guidance. So you must not ask for or accept. And then it goes on to explain any gift or hospitality that may affect or be seen to affect the way you prescribe for. So it starts off with a must not. You don't expect gifts. It's not something that should be requested. But it is something where there might be a balance around, but could it be small enough that it might not affect or be seen to affect the way I prescribe for, treat, or refer patients? Is there a difference, for example, in a box of chocolates that maybe costs £4 or £5 as opposed to somebody handing over a cheque for £100? does value affect the way it may be seen to affect the way you prescribe, treat for, or refer? And we'll unpick all of these things in the session. So something that starts off as maybe quite a small ethical scenario about accepting some chocolates or not, the types of discussions that we will go on to have can be really quite rich around this. And we always highlight as well the importance of people making themselves aware of local policies. Anywhere that you work in the UK, whether it's in an NHS trust, a GP practice, there will be a local policy around many different things, but one of the things there would be is a gifts policy as well. Never surprises me the richness of the conversation that we can have on some of these shorter scenarios. We also go into some more complex scenarios as well. So we use a number of different video scenarios, which helpfully kind of breaks up the day as well in terms of having different formats and different ways that we deliver the session. So this is the GMC waiting room, and I will take you and show you one of our video scenarios. So this is Mr. Hughes, and I'm going to play that for you now.
Whenever I feel afraid, I hold my head erect and whistle a happy tune, so no one will suspect I'm afraid.
Let's get you back to your feet, okay?
Shivering in my shoes, I strike a careless pose and whistle a happy tune, and no one ever knows I'm afraid.
Come on, careful now.
The result, I whistle.
It's good. There you
I
go.
whistle.
There you go. Take a seat. Come on, take a seat. There you go. Okay, sit back. Sit back. Relax. Are you calm?
Whistle.
Are you calm? Okay.
Whistle.
I'm gonna get the doctor for you, okay?
Whistle.
Okay.
Whistle. Whistle. Whistle.
Everything okay?
Doctor, I was wondering if I could talk to you about Mr. Hughes, please.
Yes, of course.
Well, Mr. Hughes is quite confused and agitated at the moment.
Yes, he is, isn't he?
Yes, well, he keeps wandering off and he's making a lot of noise. The other patients are being disturbed and some of them have complained. I was wondering perhaps if a sedative might be appropriate to help calm him down a bit and keep him quiet.
Okay, hopefully that video played okay for you. So what we normally do at this point is open it up to the room and ask people to vote, would you give Mr. Hughes the sedative as requested? So Mr. Hughes is the male patient there who's singing away, maybe causing a bit of disruption to the ward. Some of the other patients aren't unhappy about the noise and the disruption, and obviously they're not feeling well themselves. But a request for a sedative from the member of nursing staff there. So I just want you to think to yourself, would you give Mr. Hughes the sedative as requested or not? So we normally get people to vote in relation to that, and we can get a really quite mixed response to this one. We only ask for a yes/no response, and then we unpick some of the factors. But this is a really important scenario in terms of unpicking some really fundamental aspects in terms of delivering care in the UK and how decision making works. Because we don't just go and do things to patients. We certainly don't go and do things to patients that aren't something that isn't of clinical need or in their interests. And if they have capacity, mental capacity, which the legal starting presumption is, they do have capacity if they're over 16, is that they have the right to make that decision for themselves. If there's anything to indicate they might not have mental capacity, in the UK, there's a very set framework. It can differ around the 4 countries of the UK. For example, in England, it is a Mental Capacity Act that lays out really clearly the structure that needs to be followed. And in particular, how you would then go about assessing capacity. There's a very specific way that it has to be done. So this scenario touches on the fundamentals of decision making and consent, even the basics about thinking, you need to go and assess that patient as well. Do you know what is going on for this patient? It was mentioned that they're confused and agitated. They're singing, they seem fairly happy. Are they? Is that normal for them? Is there something else going on? And then work through kind of the decision making and consent process for anything that you did think was indicated. However, it's very unlikely that in this situation, a sedative would be the most appropriate option. So if you look at our good medical practice in prescribing guidance as well, we take attendees through this in detail because actually there is some absolute gold in there in terms of covering this situation. And if you got this request, why you might need to challenge it back. We also highlight things like our ethical hub on our website. So the assessment of mental capacity, we know that even for those who've graduated in the UK, this can still be quite a challenging area. So there are lots of resources to support on the GMC website. This one, for example, has videos that are involved and very simple to understand ways that we break down how you might go about assessing capacity if that was needed. And then importantly, what do you do if somebody is determined to lack capacity? So we could spend ages kind of going through into those areas, but I just wanted to give you a flavour of the types of things we start to touch and explore. And again, we always leave you with kind of the right answer in this situation. These are tiny little snippets. There may be wider information that could sit around the actual scenario itself. But fundamentally with prescribing, for example, you should only prescribe medicines if you have adequate knowledge of the patient's health. And importantly here, you are satisfied they serve the patient's needs. So that's the patient's needs, not other people's needs. And you can see paragraph 65 gives more information there, very specifically that you must not prescribe medicines for your own convenience or the convenience of other health or social care professionals. This comes direct from our guidance and gives a specific example around the prescribing of sedatives for the convenience of caring for patients with dementia in care homes. So you could see that actually the guidance itself would help lead you to the right answer in this situation. And hopefully the Welcome to UK practice session would also help make you aware of the full range of that, so that at least you were aware there's a piece of guidance that I can go and check in this particular situation. Of course, in addition to any support and advice you would get from colleagues at a local level. So we spend most of the session exploring our ethical guidance, and I suppose I just want to highlight that all of that's available on our website. It is the best way to access it. If you scroll along the blue bar at the top of our website, go to ethical guidance. It's all there, whether it's something like confidentiality, end of life care, or whether it's something like use of social media or acting as a witness in legal proceedings. There's over 30 different pieces of ethical guidance to support you in your practice. We also have something called the Ethical Hub for particular hot topics, or where it's a theme that cuts across a number of pieces of guidance. We pull out what's relevant for you in the Ethical Hub. And also just want to highlight for any registration queries that you have as well, we have some really useful pages online as well, because we've not been able to touch on that in particular today. I also wanted to just end by saying it's not only us, there's some fantastic resources out there that are freely available. Anyone could go and explore these now. And the British Medical Association have a really useful toolkit for doctors who are new to the UK. And their toolkit also includes things to do with visas and contracts, things like that, that the BMA are in a position to assist with as well. So I just wanted to highlight there's quite a lot of resources there. So thank you very much. That was a whistle-stop tour of kind of why we have Welcome to UK Practice, where it came from, and a little overview, a little snapshot of what a taster of the session is. So please do sign up to it if it's something you're offered, if you do pursue registration. And if you're still thinking about maybe coming to work in the UK, go and have a look at some of those web pages that I've highlighted, because there's lots that you can access before you even register with us. So thank you very much, and I'm going to hand over to Kim Tolley now.
Hi, thanks Rachel for passing over to me. Thanks ever so much. So let me introduce myself. I'm Kim Tolley. I work for the Health and Care Professionals Council as a professional liaison consultant, but basically that means I do a very similar job to Rachel at the Health and Care Professionals Council, which, as you know, regulates 15 professions, from physiotherapists to occupational therapists to art therapists, music therapists. So lots of different professional groups, as opposed to the General Medical Council that regulates doctors. So I'm a nurse by profession, and I love working in regulation because I think it's a real opportunity to make a difference to people. And my particular interest, like Rachel's, is supporting registrants who are new to the UK. So I used to work for the General Medical Council, and Rachel and I had the joy of doing many sessions together with international registrants, international doctors. And when I joined the Health and Care Professionals Council, I was very well aware that we also need to support international allied health professionals who come over from other countries and join the register. So I started a program very similar to Welcome to UK Practice. But firstly, you've seen what the GMC do in their statutory requirements. We do exactly the same, but just to explain that we register about 400 to 700 allied health professionals from international countries, from countries other than the UK every month. We welcome them to the register, and we're delighted that they join us, as Rachel was from the General Medical Council. They make a massive difference to the National Health Service, and they make up allied health professionals who come from overseas, make up about 17% of the workforce in the NHS, as opposed to doctors from overseas who make up about 26%. So registrants generally who come from overseas make a massive contribution to the UK NHS, and we want to welcome you. And there's part of this welcome, as Rachel said, is joining sessions such as the Welcome to UK Practice programme, but the session running similarly at the HCPC is called Joining the UK Workforce. And like the General Medical Council, we have standards and guidance that our registrants have to abide by, and I've just flashed those up on the screen there. You can read them online. And we look at those standards and what it means to be a registrant in the UK and the differences between working in the UK and working overseas. So it's a very similar programme to the General Medical Council programme. So we do monthly virtual sessions. We target newly registered registrants who get an email from the Health and Care Professionals Council, and we've met about 1,000 participants so far. We've also done our first in-person event, and that is Shri up there, who is an international registrant himself, who came to talk to international registrants who joined the register. And we partnered with a trust also for a sort of cross-regulatory event later on this year, where the General Medical Council, the NMC, the Nursing Midwifery Council, and us are doing an in-person event for registrants who are new to the UK register. So we think it's really important. Both Rachel and I are really committed to the support for registrants when they join the UK workforce. So this is what we cover in our session. It's very similar to the session that Rachel's brilliantly explained, and I love the fact that Rachel showed one of the videos that I used to use at the General Medical Council all the time. So we look at what it's like to work in UK healthcare. We look at some of those everyday ethical dilemmas. We talk about reflection, but ultimately it's also about getting to know each other, because it's really important that the registrants in the room or in the virtual room get to know each other, because you're all new to the register. So these are the countries that some of our registrants come from. You can see there that we have a lot of registrants from Nigeria, from India, from the Philippines, from Pakistan, and that reflects very similarly the General Medical Council doctors that come from a variety of countries all across the world. And that's what makes the sessions so interesting and so enjoyable. We used to love doing them in person, where we could stand and have a coffee and listen to people's journeys, but the virtual world is allowing us to meet the needs of lots of international registrants, which is great. So we also do Sometimes, Always, Never, exactly as Rachel does, where we get to, this is Jo, who is a physiotherapist by trade, and Jo makes an error, and she forgets to refer a patient for another service. So she realizes she's made that error. She makes the referral straight away, so the patient wouldn't even probably know unless she told the patient. And we get, exactly like Rachel did with at the General Medical Council, we get registrants to think about whether they would tell the patient that they'd made a small mistake in a delay in referral, or they would do that sometimes, always, or never. And that's really looking at something called the duty of candour, and being one of our standards, which is called being open when things go wrong. So that's quite a nice way of talking about the duty of candour and the importance of the duty of candour in UK healthcare. So we talk about the types of duty of candour. There you can see professional and the statutory duty of candour. And if these are new terms to you, it's worth looking on our website, because we've got some information about that. Also got a video that you can watch about duty of candour, and some links that you can look at that as well. We look at saying sorry. We look at saying sorry and how you say sorry to patients. And those are just one fantastic report from NHS Resolution that talks about saying sorry. So you can see here how we're beginning to look at the differences in terms of things like raising concerns, duty of candour. Rachel already talked about prescribing differences in the UK as opposed to other countries. So it's really important that you recognise that we're not criticising practice in other countries, but what we're merely saying is sometimes it's different in the UK, and that's what we wanted to talk to you about in our sessions. So talk about ways to say sorry, and you can see I'm flashing up a slide there that talks about different ways to say sorry, and we unpick all those ways and think about how we say things in the UK. Think about record keeping as well. So I'm actually going to come off sharing my slides if you don't mind, Faisal, if that's okay. I just wanted really to talk about a few other resources that we've got at the HCPC, and Faisal and his Sunny is kindly going to put links to the HCPC website on the chat, so you can see I'm part of the professional liaison service. So if you want to contact me, you can find our email on the professional liaison service web pages on the website. So you can contact me and we can talk about other things or other support that the HCPC can give you, and other support in relation to things like joining the UK workforce. Brilliant. I'm going to hand over to Dr. Shri, who's going to talk to you about her experiences of being an international registrant. So I'm really looking forward to hearing from you, Dr. Shri, and hearing about your own experiences.
That's wonderful. Thanks so much to the organisers. Thanks for Raj to inviting me to speak, and thanks so much to Kim and our previous speaker as well. Really, really important stuff that you all need to know. So I'm going to say a little bit about me. I'm going to give you some tips as well about how I guess my career in the NHS has been, and some of the things that I've learned along the way. So I'm Indian born, but I did actually train in the UK and trained at Imperial. And then I went on to study psychiatry at the Maudsley Hospital in London. I did my PhD there as well in bipolar twins. And I went up and down the country for several years whilst I was also doing my training in psychiatry to find these twins with bipolar disorder and put them in a functional MRI scanner so that we could see the genetic loading that they might have around their neuroemotional processing. And at one point, I think we had the largest collection of twins in the world. So anyway, I went on, became a consultant psychiatrist and a senior clinical lecturer. And it's very interesting about why I moved from medicine, which was my first, general medicine, my first interest, into psychiatry. I really wanted to speak to patients, and I found that in my medical work in general medicine, I just wasn't having time to do that. Whereas in psychiatry, we talk to patients a lot. There's a lot of continuity of care, particularly in my specialty of rehabilitation psychiatry that I've chosen. So I guess my first tip to you is, find what really interests you, find what you're passionate about, because then that will make it easier for you to excel. Why do you want to choose a particular specialty or a path? What will that give you? How does it align to your values, fit in with your life? What do you want your life to have stood for? So those are all important questions that don't go blindly into, what you want to do. Think about it in depth and in detail. So then it was pretty tough, doing my PhD, carrying out my training, and also having a family. I was also at that time doing other things like writing a textbook and so on. So lots of things at the same time. And my second tip to you would be form a great support group around you. So important. A peer group of people who are working with you. And also I would suggest getting a mentor as well and a coach. There is quite a few of the trusts now around the country, and various people offer coaching. And that's really to get you to know yourself better and develop your own skills, challenge your growth, raise your ambitions, all while you're kind of living true to your values. And also in time, a sponsor. So I'd look that up if you don't know the difference between a mentor and a sponsor, someone who will speak up for you and support you in your progress. And what I always say is build a mutual fan club, actually. You know, you help others that you really appreciate and think well of, and equally you get that support and help as well. Then I went on to work in the Royal College of Psychiatrists at a national level at the executive in my particular area, which is rehabilitation. I went on to become the chair of that. And that was fantastic. I learned so much about international conference organizations, national policy. How does one engage and influence politicians and also whole sectors to make national policy change? And how do you make sure that you're not having unintended consequences as well? You know, sometimes when you tweak something in one place, things change across the board, and to make sure that that's not having a deleterious effect somewhere else. And also setting national standards. So I was really kind of privileged to win Psychiatrist of the Year for that work over the course of many years, and very surprisingly also to me was awarded a Commander of the British Empire by the Queen, which was wonderful. And it was really wonderful to be able to appreciate my parents and my other supporters, actually, because anything that you succeed in is a team effort. So it was a surprise and a huge privilege. So my third tip then is to look up and outwards, to stay curious and always be learning and make connections. And when you're speaking with others about your passions and working together, you can really lead to incredible synergies and impact even more greatly for those that you're trying to help. I then went on to work in medical management for a little bit, associate medical director for my trust. We have about 300 consultant psychiatrists and about 5,000 staff there. And then went on to a national paid leadership role with NHS England, so that I'm the national clinical lead for mental health rehabilitation. And that's been incredible work, getting data from all around the country, all the trusts, and benchmarking them to see where people are doing really well, seeing where there's what we call unwarranted variation, and helping people to learn from one another so that you can up-level services across the whole of the country. So that programme of work is still ongoing, and the spend in this area is around £550 million per year by the NHS. So by doing this work, we can improve patient experience and safety, we improve clinical outcomes, and because we are getting it right first time for people, we're able to save money in the process as well and develop better services, which mean that people can have local care rather than having to be sent far away for these specialist services. And really all my work over the years has involved raising the profile and cash for mental health care so it can be improved and be more on a par with physical health care too. And in line with that, I've moved on to become a chair of a board as well for something called the Association of Mental Health Providers, which is about 300 strong membership of charities in the mental health sector across the country. So really trying to make sure that they are sustainable, that the good work that they're doing is recognised, and that they also have a seat at the table when it comes to policy, when it comes to being funded, etc., centrally by government and local authorities. So just to kind of draw to a close, as a senior clinical leader a few years ago, I got to the brink of burnout. And it really is three-pronged, and I could see all of these in action. I could see the internal factors became more apparent, what was going on with my line manager, and the factors that also contributed from my organisation. And it was very interesting to me, actually, as a psychiatrist, but also as somebody who'd been leading for the Royal College of Psychiatrists on workforce wellbeing for a number of years before this. So I used evidence-based methods to bring myself back from the brink of burnout. And what became really, really clear to me was that the support that staff get needed to be stronger. Okay, the wellbeing support. Leaders need training as well, so that we can get the working culture right, so that they're not part of the problem. And what I did, I trained as a coach and I still run leadership development programs through the Live Well Mastermind. And I also then developed now something called the Key Life Indicator Plan, or CLIP Global, as it's known. And that was really through the support of the NHS England Clinical Entrepreneur Programme. I felt really strongly that staff needed improved support, and it needed to be holistic, preventative, personalised, and that's what we've developed. We've been getting some incredible results with that, with people coming back to work after being off sick, with stress and so on when other things haven't worked, and literally people saying, thank you for giving me my life back. And people staying in the profession rather than leaving as well, after they thought this is enough, I'm going to leave the profession. So that's been really incredible and a privilege to be able to bring the service to people and see that sort of change. And others have had other improvements, for example, improving the way that they communicate and get on with their colleagues, which has meant again that they've come back to enjoying work and staying in work rather than leaving. Other people have done things like getting back to exercise and running half marathons again. Others have improved their relationships at home, which has reduced their stress, and they're coming to work more happily. So many different kind of ways that we've supported people to improve. Really, the people have set their own goals, and then we've been able to support them through that. And so what I'd say there is as my kind of tip at the end is keep evolving. A portfolio career where you've got your interests and passions at the heart. You can see all of these things are kind of linked through my career so far. And that's, I think, where you really can bring to the fore your strengths and bring to the world your sort of innate interests and talents. And each of you, every one of you listening, has those. And as a coach and somebody who has done this work through CLIP, I absolutely know that. I see it every day in people kind of evolving and developing what they're good at, and by doing so having a greater positive impact on the world. So I guess my wish for all of you is that you're able to find that for yourselves, be it in the UK, in our NHS and healthcare service, or wherever you're working. So I want to wish you all the very best, and thank you so much for listening.
Thank you so much, Shri, for the talk and for just sharing, I think, immense life experiences that give us a breadth of freshness in a time where we need such insights. At the same time, I'd also like to thank our speakers, Rachel and Kim, who've given us a very comprehensive overview of sort of the welcome to UK practice, but in general, the efforts behind bringing together medical education for the international healthcare community who are interested to join the UK, be it at the moment or they might be already as part of the workforce, and this could help them bring their passion to life. So all in all, I think the event really brought together some excellent work being done from the GMC and the Health and Care Professions Council. And at the same time, we've got this inspiring story to take home with us from Shri and her work at CLIP. So thank you everyone from our speakers and our viewers who've tuned in today. I hope Health Careers Live South Asia was representative of the views and the interests of our audience on a global scale. And as we know, the South Asian Heritage Month just concluded a while ago, and efforts and events like these help us bring forward and continue the legacy of the inspiration that the South Asian community and the international wider medical community brings to the healthcare world. In terms of our viewers, if you have any further comments or questions, feel free to use our hashtag HealthCareersLive, and our emails and our social media handles are available to reach out to our speakers in the future or learn more about the upcoming work in terms of the National Health Careers Conference in September, as well as other exciting events in the making. Thank you again, and have a nice day.